Welcome to City Talk, a weekly conversation produced by the City of Waco to inform you about city events and projects. Each week, we'll bring you interesting topics with city staff and community leaders to highlight how Waco is an exciting place to live and work.
Hello, everyone, and welcome to City Talk. I'm your guest host for this week, Kelly Crane with the Waco-McLennan County Public Health District. And my guests this week are Cheryl Allen, who is the Director of Programming and Advancement of Voice, and James Mazza, who is the VASA Community Coalition Coordinator, also with Voice. So thank you both for being here. And let's just start with something simple. A lot of people don't know, what is Voice? What is VASA?
Well, Voice is a nonprofit that teaches critical life skills to children and families in our community. VASA is a program of Voice, and I'll tell you a little bit more about that in a moment. But we go into schools and community sites to teach critical life skills in order to help children and their families have successful lives and, therefore, successful futures. We are funded by the state of Texas to do tobacco, alcohol, and drug prevention education. Our mission, as I stated, was successful lives, which works perfectly with prevention. And what our programs are all evidence-based. They've been proven to work. And so they increase protective factors such as strong relationships with family and friends, parental involvement, appropriate social skills, and lower risk factors, which are the opposite of that. And one risk factor is inappropriate behavior, such as truancy. And for example, we have a program that addresses truancy, actually called Strengthening Family Program. Then the VASA is a little bit different than our other programs in that it is a community coalition. So it's a group of like-minded people that come together to research and implement strategies on a larger level throughout McLennan County. So that would be policies and creating awareness and things such as that.
And that's all what public health is about, is looking at the environment and saying, where are food deserts? What is going on with the open? What are the conditions that we're dealing with, and how can we improve those conditions to make the healthy choice the easiest choice? So, James, let's talk about VASA. And that's kind of what we're here to discuss, is specifically the opioid crisis. I always think of this as like almost a hidden issue or crisis in our community. A lot of people don't realize it. They don't realize that people next to them or they work with may be having these issues, having these concerns. But it is. We're a part of the United States. It's across the United States. Tell us, what are some of the challenges within our own community regarding substance abuse and misuse?
So one of the interesting things is a lot of people find or the viewpoint is that marijuana is the big drug or the big substance that's used. And it turns out that kids actually tend to get their start with prescription medication. And a lot of times it tends to be opioids that are painkillers that may be in the form of Oxycontin or maybe some Vicodin, morphine, codeine. All of these are more familiarized brand names, but that's typically where children start. Is it's not with marijuana, but it tends to be more with the opioids and prescription medications.
And we think about, with teenagers, that's an age group that they have surgeries, they break bones, they may have to have their wisdom teeth out, they may have to have serious dental surgery, and that all requires pain medication. And so here it is. You're used to taking it. It makes you feel better. Go right ahead. So can you tell us a little bit about what is specifically an opioid? You kind of mentioned it, and it's a broad family of medications, and people may not realize that they're taking something that is classified as an opioid.
Very, very true. So opioids are considered anything that is a morphine derivative or anything that kind of comes from the natural history of morphine, which is the poppy plant. There are a couple of synthetic opioids. The more popular or more widely known one is heroin. And then another synthetic version of morphine is fentanyl, which is considered to be 100 times more potent than morphine. So there's a lot of good information out there about it.
That is an interesting fact. I didn't know that. And that's another thing. It's like, are all opioids created equal? Particularly, I guess, when we're talking about the prescription brands, are they all created equal? Is if you see that, you're having your wisdom teeth taken out and the doctor prescribes Vicodin, should you be like, oh, I don't think I want this. Oh, this is no. I mean, what? They're there for a purpose. It's just a purpose that's been. Are they all created equal? Are they all equally as dangerous? What? Yeah.
So, all different versions of opioids, their chemical composition varies slightly, and a lot of times the only reason to change the opioid that you're taking is because you might have an allergic reaction to one brand over the other. Mm-hmm. But in terms of their effect, in terms of their addictiveness and their side effects, they're all roughly similar in terms of how they affect you.
Mm-hmm. So if someone is getting, and I'm kind of going off topic on our questions, but I'm just curious now. I'm just curious. So if someone, and it's because people are listening and think, oh, well, wait, I was prescribed that, or I'm about to have a surgery. My first response would be, as public health, would be, oh, talk to your doctor first. Ask him your questions. What should they be thinking? Should they say, oh, absolutely not? Have that conversation with their doctor?
No, they definitely should, and it's kind of a great point that you bring that up, because I've got a great segue. There is an opioid crisis that's been going on in America, and that all stems from the fact that doctors were originally told that opioids, specifically long-term opioids, were less addictive. And so they were marketed that way, and the doctors went out and were prescribing them to patients at a very high rate because they felt that this was the safer way to take care of pain and to manage pain, when, come to find out, they were just as addicting. So the FDA has kind of put in place some protocols, and it typically starts off that doctors, instead of prescribing some sort of opioid intervention, they're supposed to go through maybe occupational therapy or some sort of stress reliever to try to reduce any sort of pain or tension in the body. The next step would be to do something that's like steroids or any sort of anti-inflammation. Mm-hmm. And the final step is, if nothing else works, then they do pain management through opioids. And it used to be that you were given a month's supply of opioids. Now it's 3 to 7 days.
Yeah, and that's a significant difference. And that goes into we're talking about policy and how we look at the overall process. So let's start. And you kind of mentioned it a little bit, and we've heard a lot about. There was an HBO documentary about it, but why are we hearing about the opioid crisis now? It's a continual, it's been a building conversation, a growing conversation. I know that a lot of pharmaceutical companies have recently settled with states on this issue. So kind of backtrack, give us a little bit of the history of how this happened. And you said some interesting things with the last question, but give us that history and what's going on right now.
So the opioid crisis sort of came and started about 1996. This was with the invention of extended-release OxyContin. And that's what was marketed as being more reliable, having less side effects, being more efficient, and the safer medication. So doctors really bought into this idea that this medication was kind of a miracle cure-all without all the side effects. Well, the study that the medication was based upon turned out to be what's the word for it?
Flawed.
Yeah.
Flawed.
Incomplete.
That would be a great way to say it.
Yeah.
So the study was very flawed in its findings, and about 10 years later, more significant research was done on the medication and found out that it was just as addicting as the other opioids involved. So you fast forward to about 2012 is when we start to hear about how this opioid crisis has started. Okay. Well, a lot of the people that were prescribed this medication, they're 10 years out, and they're now addicted to the opioid medications that they were told were going to be safe. So to kind of put it in perspective for you, in the year 1996, there was 6,000 opioid-related deaths. Well, in the year 2016, 20 years later, there was 50,000 opioid-related deaths.
That's a significant jump, and that's increase of use, increase of dosage, long-term, a lot of reasons. When we think about that, in the news I hear about places in states like Florida, West Virginia, Pennsylvania, areas of Appalachia where this was occurring. We don't think about it here in our neck of the woods. It's like, oh, we're not in that area, so it's just focused on there. But it's a part of our community as well. Tell us a little bit more about our community and what that means to us.
So you actually really kind of hit the nail on the head earlier when you were talking about how children they have to go through medical procedures all the time, whether it be a dislocated joint, a broken bone, maybe they're having wisdom teeth removed or braces, and then after that procedure, they're prescribed pain medication. And a lot of people don't know, but the average age of use for opioids is around the age of 16. That's around the average age of when people first start.
Is that, we talked a little bit about that earlier, and is that all kids being prescribed, or is there other ways that they're getting a hold of
and
this?
so the first contact is typically through their doctor, through their primary care physician, or through their surgeon. And typically, they don't actually get any drugs illicitly until that prescription is no longer available. So we're talking maybe 6 months down the road when they start to turn to different sorts of opioids to fill that void.
Okay. And, I think that's what makes this so insidious, is that you are in pain, you're provided a prescription to help that for you, to help you recover, and you trust. And then it overtakes you. And there are many other ways that I know there are other ways, but just that basic idea that you were prescribed this to make you feel better, and then it turns on you in a certain way. It turns on you. So I can see how it's so frustrating. So, we're talking, so we have this issue, I know you focus a lot with young people, but of course it affects all ages, but that's the thing, everyone could be a part of this. So let's talk about signs of opioid misuse. So how do you know this is going on? If you're seeing someone, how do you recognize these signs? Whether it is, your child, a friend, a student, what are you looking for?
So a lot of times it's a drastic change in behavior. So it might be somebody who was very outgoing is all of a sudden a recluse, or somebody who was really talkative and really wanted to engage, really kind of likes to isolate now. Typically these people turn into loners. They only hang out with a specific group of friends, and you'll notice that after they come back to hanging out with this group, or after they go out and hanging with this area, they come back and they typically are jaded, they're defensive, or they're angry or aggressive. A lot of times that's a sign of withdrawal or recent use of opioids. So it's kind of important to monitor how your friends and family are behaving. Excuse me. And if you see any drastic change, a lot of times that's a signal of something has gone on, or they may be trying to experiment, or they may be unsure or unaware. So it's important to just address the behavior and say, hey, I've noticed you've been acting a little different. Would you like to speak with me, or, maybe a therapist, or whatever avenue you'd like to take, but just to have that conversation.
And when you think about teenagers, there's always this idea that they have their own, terrible two stage. But there is rebellion, and there's different behaviors. There's where it's a stark contrast.
Correct. It's very noticeable.
So is there also physical signs like weight gain or weight loss, or
you'll typically see whenever opioid misuse is becoming more of an addiction, you'll typically see the people's faces will start to develop sores from itching and scratching. They will lose weight. They will become skinny. They might be sleeping all the time. A great way to describe somebody who is a chronic opioid user is a catatonic zombie. Wow. So what that means is they're very lethargic. They may move very slowly. They may not even seem like they really are aware of what's going on around them. And a lot of that is the withdrawal symptoms from chronic use of opioids.
You're almost, the way you describe it, I always talk about there's the movie style version of what something looks like and the real version of what something looks like. You're almost describing the movie version of that. These are these classic scenes that we've seen in television shows and documentaries. It really is that classic.
Very much so.
Wow, right. So we've talked about, now we've got everyone kind of shocked and depressed and afraid of going to the doctor and trusting the doctor. And of course, that almost is another discussion. You've got to trust your doctor. If you are concerned, have that conversation. I always say, you are the team captain and your quarterback is the doctor.
Right.
So you work with him and you develop that game plan before you have to have surgery,
Correct.
Before this is going to be prescribed, to have that understanding what expectations there are, what expectations there are.
Very true.
I always say, if you're in a surgery situation and you're still in pain after 3 days, you need to tell them. That's not how it's supposed to be.
And a great way to think about that is, and I'm quoting the great Rusty Garrett here, is we are here to prepare you, not to scare you.
Absolutely. That's
good.
That's a great. I would use that too. So that's a great way of doing that. So yeah, start off being prepared, be controlled. So that is kind of a preventative before you get there. So since we've scared everybody, but let's kind of dial it back and let's talk about, okay, what does this mean? What does treatment look like? Because there is treatment out there. There is hope. Just because this started doesn't mean it's going to end badly.
Very true. And the great thing about, and I'm saying great, even though opioid addiction is a terrible disease, but the great thing about opioid addiction is that it is treatable, it is curable, it is preventable, and a lot of that revolves around having a great support system, being involved in therapy if you're already starting to notice changes in your behavior or somebody's noticing it for you. Talking to a licensed chemical dependency counselor or an LCDC. These are people that specialize in dealing with addiction. There are methadone clinics around, which what they do is they provide you with a opioid synthetic that blocks a lot of the withdrawal symptoms and the cravings for opioids, and they help you to detox and withdraw in a systematic way, so that way it's not as severe. You can also go to Narcotics Anonymous. There are several nonprofit groups that host group counseling and talking about addiction and opioids specifically. So there are ways to address that problem, and a lot of them are actually free. And the only real barrier to entry is just calling and making sure there's a space available.
Yeah.
And that's the great thing about it.
Yeah. Movie version, reality version. We have the intervention television show, which is the most dramatic extreme that doesn't wrap up to the last 3 minutes. But there's more than that. There's more than that. You don't have to fly across the country
Correct.
to get help. You don't have to do that. You can. It's interesting that you talk about there's simple things. There's counseling. There's free counseling. There's a support system. There's a lot of different things out there that we don't normally think about. Yeah, we think about, okay, you got to fly across the country. Okay, you have to hire somebody and have a meeting in a hotel room. You don't have to do that. You don't have to do that.
Right.
So in your dealing with, as the Community Coalition Coordinator, talk a little bit about what your group does. Can you talk a little bit about how many people are involved? What is their motivation for this? How many groups? Yeah.
Well, my elevator pitch is I like to say that we're promoting education through dissemination of information.
Okay.
So it rolls right off the tongue.
There you go.
So we have a large number of members that are involved in different nonprofits, that are involved in different sectors. We have people that are community leaders that are involved. They're church leaders. They're business owners. They are involved in the local school districts. If you can think of a certain field, I guarantee we have somebody from that field involved in our coalition.
It touches everybody.
It does.
And one way or the other, it touches everybody.
If
you're an employer, this touches you.
Correct.
Yeah, this is important. If you are in a school, obviously this affects you. If you're in the healthcare profession, this affects you. You want to take care of your employees, you want to take care of your kids, you want to take care of your patients.
100%.
This affects everybody in one way or another, whatever your field of business is. Of course, you focus specifically on teenagers, youth. You threw out an important statistic, and we haven't even talked about it yet, and I thought it was so important, and I don't want to miss this because, so you said the average use was 16.
Yes, ma'am.
And then what is the average age of death?
So the average use or the average date of first use is around the age of 16. And then the average user will typically die around the age of 20. So we're talking about a 4-year disparity.
That's a 4-year disparity. That's a crucial time. That's a crucial time. And I could see how it would be easy to miss because you're thinking, oh, well, they got the car license and everything changes when you get your car license.
Right.
But does it? What is really a start of how this affects?
Right. So I think it's something important to note that it's a crisis because of how short the time period is. You know, when you only have 4 years to intervene to get that help. And a lot of people don't know this, but when somebody seeks help, they usually don't recover or enter into the recovery phase until several times after they seek help. So it's not done in the first try. It's having that support system that matters and helping them continually go through that process.
If you think how many times people have gone on diets
Exactly.
to lose weight, these are simple things, supposedly simple things. Imagine changing an addiction behavior, an addictive behavior.
Exactly. And it's not just a lifestyle change, it's a community event. You know, these people that are experiencing substance use disorder, they need to feel a type of solidarity, that they have a support system, that they have someone that they can talk to, and to know that, you know, they're not isolated, because that's how substance use disorder turns lethal.
Yeah. And for families out there, are there support systems for families? Because if you were sitting in that situation and you've never had to deal with this issue, and now you have your teenager acting weird, where do you go for help? What can you do for help? Where do you start?
There is actually a lot of free resources, and I'm a big proponent of group counseling and of family therapy. If you have loved ones that are struggling with addiction and you don't know what to do or where to go, there are a lot of groups in Waco and McLennan County specifically that involve talking with people that struggle with the same problems. And it's a great resource to be able to link to each other and say, hey, I'm going through this. How have you handled that? Just kind of having that solidarity in your community. It does wonders to help relieve you of that pressure and that burden, because you're not the only one.
And that's another point thing. Unfortunately, in the world we live in, you're not the only one. You're not the only one. How do they access these resources? Can they go to your website, or where can they just Google it? What is the best way for them to find out more information?
So our website does have some links and access to resources. One of the best things that you can do is to call some of the local nonprofits here. I know that MHMR is a great one that has a lot of free counseling. I know that Starry does a lot of free counseling as well. And those are kind of the great places to start. And if they're booked and they can't help you, they have referrals to other places that aren't maybe as booked.
Absolutely.
So.
And I'm a big fan of MHMR. They've done so much to offer counseling to all of the community. It really is such an important difference. Well, we're sitting here with remaining about 3 minutes to continue talking up, kind of slowly wrap up. Let's talk. We want to mention this because this is a twice-a-year event, and that's the prescription take-back program. And this is very important. If you have, you had that, dental surgery and you've got a few, pain relievers that you're like, well, I don't want to throw this away because I don't want to, poison my water system or the community. What do? You've got a drug take back. Tell us about that a little bit, Cheryl.
Well, this would be a perfect example of a VASA project, and we've, for several years, worked with the DEA to take back prescription drugs because we worry sometimes, they're going to throw them away and they'll get in the water system, but they don't. People just hold on to them. But also another big experience of people collecting large amounts of prescription drugs are senior adults, and then perhaps they pass away. Now we have a lot of prescription drugs. What do you do with them? And there's several different ways in which that can be handled. One of them is this cool little bag.
I noticed this, and we've had these sitting there. These are very interesting.
And we have many of these.
Loads of them.
To hand out to people. You open it, you put in your prescription drugs, add water, seal it, it deactivates, and you throw it away.
In your garbage can.
Yes.
In your garbage can.
In your garbage can. Privacy.
Oh, that's a good point.
Yeah, because a lot of people are like, I'm not a drug addict, I promise, but I just, Yeah.
So, and then, but the great thing that's happened in the last couple of years are there's some permanent places. A lot of drugstores like Walgreens or CVS will take them and properly dispose of them. But what you were mentioning was the DA Take Back Day, and that will be October 23rd, and most of the police stations in McLennan County will allow anyone to come in and dispose of whatever amount. But again, privacy. They don't judge them. They just have a container for them.
Again, everyone has a pillbox that they didn't finish and they don't want to throw it away because they don't know what to do with it. And this is a great example of what you can do with it. So,
well, let me just mention too why that's so important. Because oftentimes, as he stated, even if they maybe start with prescribed prescriptions, youth or anyone, then when they can't afford it or they can no longer get the prescription, or maybe some of them even just start by accessing prescription drugs from other people. So when you have those medications sitting around, other people are not against just taking them.
You're in your home together. It's nothing to use a restroom, and then there's where you usually keep everyone knows where you keep the cough syrup and the medication, so it's very easy to just step in and take it. So we have about 30 seconds left. So in the remaining 30 seconds, there's no pressure, but what would be the most important takeaway you have for when we're dealing with this opioid crisis?
So I think the most important takeaway is there is a stigma attached to, people that have substance use disorder. And if I can, teach anybody something, or if I can give somebody one thing to walk away with today, it's that substance use disorder is a disease and everybody who suffers from it does need help. So we need to try to band together as a community and to lift others up and not put them down.
Oh, that's so great. Thank you so much. And thank you, James Mazza, Vasa Community Coalition Coordinator for Voice, and Cheryl Allen, Director of Program Advancement for Voice. This is Kelly Crane. I'm your guest host this week for City Talk, and we appreciate you listening or watching in, and we'll see you next week. Thank you both.
Thank you.
We hope you enjoyed City Talk, a production of the City of Waco. Catch this program on local radio stations on Sunday mornings at 6:30 a.m. Find the podcast on your favorite podcast streaming service by searching City of Waco, or view it online at wccc.tv.